I am so thrilled to see everyone. I am Tanika. I'm the founder of the White Dress Project. For those of you who may not know, we are a nonprofit organization that is dedicated to raising awareness of uterine fibroids, but we often have discussions around maternal health, around cervical cancer, fibroids, PCOS, endometriosis. So I'd like to welcome you tonight to our What the F series about understanding the connection between fibroids, cervical cancer, and maternal health. If you signed up for this tonight, then you know that this is a very important discussion as we honor the lives and stories of Krystal Anderson and Jessica Pettway. We are so honored tonight to be joined by Krystal's husband, Clayton Anderson, and to hear his very touching story of his wife's journey and just what he wants to make sure that we understand and that we learn from his wife's story. I'm going to pass it to Adrianna Hopkins, who has just been a dear friend of the White Dress Project and has a very touching story as well regarding her journey to motherhood. So tonight, as you think about the stories that you'll hear, the information that you'll learn, I want you to think about your own personal story. I want you to think about how you can share this information with someone else. And I want you to think about how you can be your own best health advocate, because it's through these stories that we share and we learn that we really learn how to advocate for ourselves. And sometimes we learn that through very tragic stories, but it is always a lesson for us to learn and to share. So thank you all so much for joining us tonight, and I'm going to pass it to Adrianna Hopkins.
Tanika, thank you so much for getting us the debrief on the housekeeping and introducing the event tonight. Thank you, as always, for inviting me to host. I am always a bit anxious about these events, especially because we're coming together tonight on such a sad, tragic topic. But as Tanika said, it's something that we have to keep in the forefront of the conversation. We're just coming off of Black Maternal Health Week. It's only a week, and we need years to get the work done in our community to make sure that we are simply surviving childbirth. It seems like we're having a really difficult time doing that. As much as we advocate for ourselves, the system seems to be stacked against us. That being said, Clayton Anderson, as Tanika said, is with us tonight. And Clayton, I just want to say thank you so much for showing up.
Thank you for letting me join to share Krystal's story and the story of our children too. I don't want them to get lost in this. It's minute by minute, hour by hour, it changes pretty rapidly. I did get a chance to go spend time with my family at the cemetery this afternoon, which is always full of a lot of tears, but it is also where I feel the most at peace. So this afternoon was awesome, but I feel more.
Tell us about Krystal, because we've all seen the pictures, we've all read the comments on various news articles and newspapers, and she just looks like she radiates this bubbly personality. Someone, I would have liked to go out with and have a drink with her. So tell us about Krystal, your favorite thing about Krystal.
She was joy, like the word joy personified. That was my wife, my best friend. When she went into a room, like the room just lit up. If she didn't know you, she was going to meet you and make you be her friend. And then she was going to cheer you on. She wanted nothing but success for all of her people, myself included. And she was just a wonderful person.
Yeah, in reading articles about Krystal's life, it struck me that she was passionate about Black maternal health. Can you talk about that and kind of what inspired her to get involved in this issue?
Yeah, she was passionate about a number of things, and her work specifically around Black maternal health is kind of where it all kind of came together. And she was a cheerleader for all Black women, period. She was a cheerleader for Black women in STEM, in technology, medicine. And then she really, we had a saying in our house that we were team human. It didn't matter what color or credo or what religion you were, we were team human. And so when she was working at the company, the software company that we worked at, the time she enjoyed the most was when she was working on women's health, specifically developing a patent around postpartum hemorrhage and blood loss risks that come along with it. It really was the convergence of everything that she was passionate about: technology, women, Black women, healthcare, all of it. She could have gone, out of college to go work for a social media company or something else, but she felt that healthcare was too important to stay the same, and so that's where she wanted to make an impact.
And this is where she could make that impact and she could make a difference. I do want to ask you, as you all are going through this pregnancy journey, obviously she is hyper aware of the issues that Black women face in terms of maternal health. Were you as aware of this? I mean, I feel like even for myself, it wasn't until I got pregnant and had an issue that it was like, oh, okay, so I'm not alone as a Black woman in dealing with this.
Yeah, the simple answer is no. She, I'm sure everybody here probably can understand that I had a lot of learning to do when it came to Black women culture and everything. But health specifically, going along with that, she specifically said, I want a Black OBGYN because I have concerns about being heard. And things like that. And I didn't fully understand that until, we started going through this journey. And sadly, I think there's a lot of people that were in my shoes that really don't understand it until you see it or witness it. And that is a big thing that needs to change.
How was it that she was advocating for herself? I just want to give the audience an idea of what advocacy for yourself looks like. We talk a lot at these events with the White Dress Project that you go to the doctor, you go to the hospital, those are the experts. So you trust that they have your best interest at heart. But oftentimes you don't feel like you can speak up. You feel like you might be insulting their intelligence. You feel like maybe you're not heard. So what did advocacy look like for your wife?
Yeah, it is an area that keeps me up a lot every night. Wishing that, we did have our Black OBGYN and we had a lot of conversations about fibroids. Historically, she had a myomectomy to remove the fibroids after our first stillborn. But I don't think we advocated well enough when it came to maternal fetal medicine. And that is something that haunts me, quite frankly, every night.
So I would say to you, and I might even bring Tori in here because she is a therapist, but I would say to you, you don't know what you don't know, and we don't know how to advocate. And then when we're in it, it's hard to learn. And so the reason why we have these events is so we can all talk and share the information. So for the next person who might unfortunately find themselves in that situation, they have a little bit extra insight. But I don't want you to beat yourself up because you do go to the doctor trusting that they have your best interest at heart. As Tanika said, Tori is our resident, get our mind right, take the blame off and get us through. So Tori, what would you say about, it just breaks my heart that you're going through so much and you're saying now you're haunted at night as well. So what would you say, Tori?
Clayton, I want to just let you know that as you are moving through this grieving process, a part of that feeling of the churning at night and the difficulty sleeping, wondering if there was something that you could have done differently, is a part of this process as you are moving toward your healing. As Adrianna said, she is absolutely correct in that we don't know what we don't know. And I really hate when we talk about hindsight being 2020 because it's really not. The Clayton that sits here with us today has so much more information than the Clayton that sat with his wife and watched the pregnancy test and took the sonogram. These are two different people having to walk through the exact same experience. So as you are processing your loss, just remember that the man you are today is not the man who started this process with Krystal. He didn't have as much information. He didn't have the experience, but more importantly, he didn't have the loss. And so he would not have known, you would not have known then what you know now. So this is why hindsight doesn't work when we're grieving. The only thing it does give us is insight, but it doesn't help us in terms of hindsight.
Yeah, I just want to make sure that you have the right perspective kind of as you're moving through this. These aren't decisions that you made. You're not a doctor, and you know, it's not your expertise, it's not your field. So I will be praying for you that God will give you comfort in that arena. But I cannot imagine, I cannot fathom what you're going through. So Tori, thank you. I'll be bringing you back in the loop. But Clayton, I want to ask you, you know, what would your wife want people to know about the advocacy, about, you know, the steps that you all were taking to make sure that you were protected in this second pregnancy and delivery? What would she want people to know about that journey?
Yeah, you know, I think you touched on the fact that you know we put our entire trust in the doctors. I keep hearing, you know, in some of the talks that I've had, the words uninformed patient, and that's where we were coming from. You know, we were not the doctor. We were the uninformed patient. We learned a lot with our first stillborn, and so we thought we had formed a pretty good plan with for our second pregnancy. And you know, another thing about my wife is she was a rule follower to a T. And so when they said, hey, no more fish for more than 2 nights a week, okay, changing the diet, you need to add fiber, you need to add folate, you need to add magnesium citrate, all of that. She had a schedule and we were following that. We were doing exactly everything down to a T. So when we did find out that we lost Charlotte, that crushed her. And it crushed both of us. But the fact that we thought we were doing everything exactly correct, why is this happening again? And then obviously it got worse from there. I think there was a couple times during our pregnancy, particularly with maternal fetal medicine, where they said, listen, we're not going to start setting up a plan until week 14. Okay. You know, maybe that's normal to not start until the second trimester, but you know, Krystal was 40, black, had a previous loss. There is something to taking care of the person and not just the pregnant patient.
Yes.
That says, hey, maybe she'll sleep a little bit better at night if we have a conversation at week 10. And you know, then when we did form our plan, it was meet at week 14, 16, 18, 20, 23, and 32. We met at 14, we met at 16, we had a cerclage proceeding at week 16, but then he canceled week 18, which, you know, for everybody here who's had a loss, you know that the first pregnancy after a loss, you're so anxious. And every time you go to the bathroom, keep your fingers crossed and pray. You're not gonna. So when you go every 2 weeks, we at least were getting sleep. One night we were going to get some sleep because we heard baby girl's heartbeat and everything was okay. And so when they took that away from us and said, no, you don't need to be seen again until week 20, I wish we would have advocated harder and said, no, we're keeping that week 18. We'll be in your waiting room, whether you have us still on the schedule or not, because we need this. One, we probably, we'll never know because we didn't have it, but we needed it as a pregnant patient, but we absolutely needed it as parents, concerned parents.
Peace of mind.
Absolutely.
Mhm.
And so I wish, we would have been a little more firm on, no, we're not canceling week 18. We'll be in your waiting room. And in week 20, after we met for the anatomy scan, they sent us home, and that was after we had discovered the hourglassing. And we thought that was weird, but again, we're the uninformed patient. I wish we would have probably had somebody, a friend of ours who is a medical professional or something like that to kind of advocate for us and say, hey, maybe we should hold them for a day and let's see what this hourglassing, is it stable? Can it be improved? What can we do here rather than, a 30-minute appointment that says, oh, you're hourglassing, go home and keep your fingers crossed even more.
Let me just interrupt you because I want to make sure that everyone here on the call understands and knows what hourglassing is.
Yeah, hourglassing, so a cerclage, I guess we should start there. And if your cervix is thinning, what they will do is they will do a procedure called a cerclage, which effectively is a stitch to make sure that the cervix doesn't thin too much and you go into preterm labor. And our previous stillborn was at 19 weeks, 5 days. So there's hindsight, again, concern that maybe that was what happened with him. We'll never know, but there's probable cause. And so when that stitch, that cerclage, is placed in the cervix, and the idea is it keeps the cervix closed and the amniotic membrane stays right where it should. What happened with hourglassing is the stitch wasn't fully effective, and some of the amniotic membrane started coming through the cervix, and so you end up with what looks like an hourglass figure of most of the amniotic membrane where it should be, and some of it down here, like outside of the cervix, with the thin point of the hourglass being where the cerclage is.
I'm very curious to know, it's my understanding at the 21st week of pregnancy, that's when some problems really began to arise. What was the doctor's reaction? How did they handle it?
Yeah, so it was at our 20-week anatomy scan, and it was, a tale of two. It was a 30-minute visit, but it was really two separate. And the first 30 minutes or the first 15 minutes was looking at baby girl, and she looked amazing. 83rd percentile. She was big for her size, and her heartbeat was 158, just cruising right along. You're starting to see all the feet and the hands and the organs, and she just looked amazing. And the second part is when they came in and said, like, hey, unfortunately, it looks like mom is hourglassing. And then they told us, like, your best bet is that we can admit you to a different hospital in week 22 and keep you there until you give birth. But once that hourglassing happens, it's
That's okay. Once the hourglassing happens, you were saying.
Yeah, once the hourglassing happens, you can give birth at any minute. Your amniotic sac rupture at any minute. And if the cerclage is still in place, you can't really give birth, but the leaking of that amniotic fluid presents a high risk for infection. Obviously, your likelihood of losing the baby is, if they don't have the fluid around them, that skyrockets as well. And so you're kind of sitting there holding this water balloon, hoping it doesn't break. And for them to send us home right away, they said it's just standard protocol. So we took them at their word for it. It seems crazy. but we didn't know any better. And, you know, we're driving home and we're like, weird, right? Like, I'm not a doctor. We don't live at a place that's got medical equipment. You know, obviously you heard we have dogs, so we try to keep the house as clean as possible, but it's not as clean as a hospital.
Right.
It seems insane that they're sending us home when, and again, we learned since they could have held us for a day or two. Or would have been an easy argument with insurance to better understand how bad is the hourglassing. Is it stable? Can it be reversed by putting her in a upside down reverse Ellenberger, and even potentially perform a rescue cerclage, which would be a second stitch, since the first one didn't turn out so well, to make sure that we increase our viability of getting A to week 22, but ideally closer to week 30. There was going to be a strong chance that Charlotte was going to have to be born and put into a NICU because of this, her cervix anyways. We were not going to make it to 37, 36, even 36 weeks, but just getting to a more viable timeline is when we were.
Even in hearing you describe that, I hope that you let the blame of yourself go, because again, I would have done the same thing you all did. I go to the hospital, I trust what you say go home, I'm going home. I mean, I can't barricade myself in the hospital. You know, if you're not going to admit me, then I'm just going to do what you say. If I were in, you know, I would let the doctors be haunted by this at night, because it sounds like they made some really poor medical decisions. And here we are. I want to ask you, you know, in light of what Krystal was passionate about, in light of this situation, how can we help you? How can we help the mission? How can we help continue her legacy and Charlotte's legacy?
Yes, thank you for even offering that. That means a lot to me. You know, I think, you know, I reflect on this 24 hours a day. And one of the things that constantly sticks out to me is, you know, people do cite statistics, and the statistics are not okay. They're not acceptable. But people also, with statistics as a whole, just think of them as numbers. They don't think about the person that is behind that statistic, the impact they've made with their time here, the impact they left, and the hole that they left in their, you know, Krystal was her mom's only daughter. So you've got Mama Bertha, you've got myself, you've got all of her friends. Everybody now has to live with multiple holes in their heart. Like, Krystal isn't just a statistic. She was a person, and that person, she was contributing so much, and she left such a legacy here that, you know, she's more than just a statistic. And I think the other areas is, you know, the current system has to, it's broken. We try to give everybody the pregnancy out of the box, even with, you know, maternal fetal medicine, it's a high risk specialty. They were given her the maternal fetal medicine out of the box. When I asked them after everything happened, we had a case review, and I said, why did you cancel 18? And why did you send us home on 20? Was that insurance? And they said, no, that's just our protocol here. You can't be putting pregnancies into boxes and protocols, because the statistics, you know, we talk about them. Not everybody is a 23-year-old white woman with no complications. These pregnancies need to be personalized, and until they are, the numbers are not going to get any better. So I think there's a fight there, and then obviously the educating the uninformed patient as best we can. I think if we would have known a little bit more, we probably would have fought a little bit harder. But we're having to learn now the hard way.
Yeah, what you said, pregnancy doesn't fit in a box. I mean, that is a slogan. That is something that every doctor should learn through medical school. That just nailed it. And that is so true. Pregnancy is not a box. Whether you're a 23-year-old white woman or a 40-year-old Black woman, it's going to look different for everyone. Thank you so, so much for sharing your story. I can't imagine how raw everything is for you. And to speak about this in front of strangers and to be this vulnerable takes so much courage. You will be in our prayers. We will be praying for your comfort and for peace. And I know that might not come for a while, but we will be praying for you. If there is any way we can support the cause, we can support you, we can support Krystal's legacy and her mission, please let us know. This is the work that we do. So please let us know. We are here to support you. If there's anything else you want to share with the audience tonight, then please feel free.
Krystal, she had an amazing legacy in her time here. She touched a lot of people. But at her service, it was standing room only, and that warmed my heart to know that she touched that many people. And I don't want her legacy to stop. So we just got to keep saying her name and reminding people that these are not just numbers. There are women behind these numbers.
Women, families, children, spouses, partners. It's just a ripple effect. Clayton, thank you. Tori, I want to bring you back. If there's anything you want to say to Clayton, if there's any, help you can offer in this time of grief and loss and mourning, please feel free. And then I certainly want to talk to you about the lessons we are all learning from this.
Yeah, Clayton, again, thank you so much for being here. The one thing that I want to remind you is I tell my clients this all the time, that time has broad shoulders. That means that you are not responsible for carrying this by yourself. Time has the strength to be able to bear up under the weight of grief until you are able to stand on your own. So don't rush the process. I know it's what we want to get through as quickly as we can, but use time to help you in bearing up under the weight of everything in life that you have to do without Krystal. I am here. I will give the contact will have my information. If you ever have a question, if you ever need to reach out, if you want to vent, if you want to scream, then I'm offering my services to be able to speak with you if ever you need to speak. Your season will be completely unique from anybody else. No one has lost Krystal in the way that you have. And your grieving process will be unique. Use time as a friend to help you. And just remember that darkness won't last always. It won't be here always.
Thank you.
Tori, I feel like it's just a very emotional thing, especially being a Black woman, having 2 kids, knowing my story, hearing stories. I hear a lot more stories of survival than I do not, but it is an emotional roller coaster for me because these are women who look like me. They're my age. They have the same dreams and hopes for family. And so it's just heartbreaking to lose another one. We've recently lost Jessica Pettway. And again, it's one of those coulda, woulda, shouldas, which isn't fair to us because she went to the doctor, she got a diagnosis, she was misdiagnosed. What are you supposed to do? This is what you trust. This is what you go along with. These are the protocols. This is what you're being told by the expert. So I want to ask for my emotional peace of mind, and for those who are listening, and for everyone who sees the headlines, and we know the statistics, and we see in some cases little progress being made. How do we build up that hedge of protection around our mental health to keep going, keep advocating, stay in the know, and keep pushing through?
Well, I think a part of the truth of the situation of the matter is that we are vicariously grieving with our sisters that we've lost in these cases and so many others. And so I think a part of it is just to be honest with ourselves that when we read the headlines and we see that another Black woman has died as a result of malfeasance on a part of medical practitioners in any area of medicine, we have to be honest that it actually impacts us in a way that is palpable, and that we feel it and that we know it, because we know that any of us at any given moment could be on the other side of a diagnosis that could lead to our demise, or to a medical emergency that could lead to our demise. And so the one thing that I say to us is one, be informed. I think Clayton was speaking about having information, and having as much information as you can in any area, in any season of your life that you can. Also, practice advocating in your everyday spaces, so that when it comes to speaking to medical professionals who can oftentimes wield knowledge against the uninformed patient, that you are already strong enough from the practice that you've done in your own everyday life to say, this doesn't feel right for me. I'm going to get a second opinion. No, I don't agree with that. Yes, I need you to put that in my chart and give me a copy of it so that I can have it for my next appointment. I don't agree with that. Be comfortable with pushing back. And if you start doing that in your everyday life, no, I'm not going to work 13 hours a day. That's not going to work for me. No, I don't want to go to this event because I don't feel well. All of this the self advocacy and the self care is really the things that we have to practice in our daily lives, so that when we come into spaces where there may be a level of authority, then we are able to speak up and advocate for ourselves. And be sure that in your everyday spaces, you are monitoring your mental health and your mental wellness, that we don't wait until there's a crisis of any sort to pay attention to that space, but that we are using our everyday spaces to advocate for our mental health and wellness.
Sorry, I was muted. I like what you said. It's really about enforcing those boundaries and feeling comfortable and authoritative in your own way, in your boundaries. And we've had these discussions before at these events, dialogue with the doctors and such. You can fire your doctor.
Absolutely.
And
You
I
can
say all the
fire your
time,
doctor.
yeah,
You can fire your therapist. You
yeah,
can even fire your employer. When you are in spaces that are unhealthy for you, there is a knowing. My grandmother used to call it the knower. And when you have it in your knower, when you feel as though you are under some duress in any situation, you have the right to break out before you break down. You
mhm.
do not have to wait until you break down to break out. You can leave these spaces and find other doctors that you feel will hear you and will listen to your concerns. Even if it's a therapist, fire them, let them go. You do not have to stay because you started one place. You can find other professionals to treat you.
I always say it's like a hairstylist. If someone jacks up your hair one time, you don't keep going back to give them a second chance to do it again. You find somebody else. It's your money, it's your mental health, it's your body. And as Clayton said, one person being lost has that ripple effect of everyone around them. So advocating for yourself is courageous, and it's really the right thing to do. I want Tori, I was talking to somebody about Krystal and Jessica, And they were saying, they're getting older and they're getting concerned about starting a family just because it seems like the odds are stacked against us before we even start. How would you advise someone to still maintain their dreams, still pursue their hopes, and not let these situations around us prevent us from going after what we want?
I would say, in essence, we all have to be sure that we are aware of the risk that is involved. And anytime we do anything, there's always a risk that's going to be involved. And so ignoring the risk doesn't make it any less risky, right? But again, I think information to inform yourself of what those risks are, and make sure that when you are reading the articles and you're reading the statistics, be sure that the participants of those studies mirror you more so than they do not. Because yes, there are a lot of statistics out there about Black women in particular having children at older ages, or a seasoned pregnancies. But now they are starting to lower those numbers about what geriatric pregnancies are. Know what those terms are. Know what they look like. Have a pulse on your own health and wellness. Again, be as informed as you can, but information should not be a barricade to you following your dreams. Much so like our feelings are to inform us, they are to give us information so then that we can come together with the proper response, so that we can garner the proper response. And so as you are sitting with your partner and sitting with your family, be sure that the information doesn't become a barricade, but that it actually does what it's supposed to do. And that is make sure that you are responding well to whatever your situation may be.
Dr. Hawkins, it's great to have you here with us. I always love talking to you at these events because you're so insightful from the medical perspective. And you admitted in the past that there are holes in the system. The system is broken. As you listen to Clayton speak tonight, and I know you're up to speed on both Krystal and Jessica. First of all, how did you as a doctor process all of that?
I will admit that my first processing of it was not as a doctor, it was as a Black woman. It was as a mother, it was as someone that unfortunately has had to stand in the gap for other physicians, because I do truly believe the system is broken. It's broken on both ends, it's broken on both sides. I want to say to Clayton, thank you. Thank you for your vulnerability, your transparency. This was a decision that you made to join us today. And it cannot be easy for you now to stand in the gap of Krystal and tell her story. Through doing that, you are absolutely uplifting her legacy and you're helping so many people. And no, I was not a part of Krystal's healthcare team. I don't do obstetrics anymore. I haven't delivered a baby in 12 years. But if you have not heard it from her team, I'm sorry. I will stand in that gap for healthcare providers to you to say, I'm sorry. And there are a lot of doctors on here on this call tonight because we all can agree that there's so much more that can be done. There's so much work that has to be done on our side when it comes from this perspective of bias, conscious or unconscious. When it comes from understanding and making a vital human connection with our patients, right? Not the statistics, not the numbers, not what the textbook says or taught us, but a literal human connection. And you say it in a different way, because I read the article and the headline struck me enormously. It punched me in my chest when I read that you said, we cannot practice a one-size-fits-all prenatal care for women, because I have always said the way that we practice medicine should not be cookie cutter. Not one day of the year do I feel like I see the same woman walk through my doors twice. And that is how we should be taking care of women, period, point blank, in every facet of it, with their fibroids, with their HPV and their pap smears, with that very first prenatal visit, all the way until we're visiting them on their second pregnancy. It should be intimately specific to them. So I will stand in the gap and tell you, I'm sorry.
You know, I know it's very easy to do the coulda, woulda, shoulda. Frankly, in listening to Clayton tell their story, I feel like they did a lot of things right. They had the Black doctor. They went to MFM. He said that Krystal was a rule follower, changed her diet, took the supplements, did what happened, what she was told to do. So I often wonder, if you feel comfortable where you are with the information you're being given from the expert that we trust, why would you get a second opinion? Should that just be something that Black women assume we should do from here on out? It just seems like you're doing everything you can to still be failed.
And I think that you've stated it, Tori has stated it, you don't know what you don't know. That is the hard part. Honestly, it is our job. It is our job to be an investigator. It is our job to be the counselor and the director, and to come up with plans, right? I love to say to my patients, honey, this is the plan for today, might change next week. This is what we might do if that doesn't work. But from a patient perspective, a patient side, you don't know what you don't know. So it is very difficult, especially because I don't know if that same premise is easy to do in the obstetrical world, right? That whole second opinion, when you have an idea of what you're going to do with your fibroids, what you want your journey to look like, your options and outcomes, it might be easy to say, yeah, no, that didn't fit, that didn't align. But imagine when you started off this journey with your obstetrician, you've created this bond and you have this great rapport and you feel like you are doing everything right? The gut emotion of it, it's nice to say that should lead us, but the reality is that as lay people, you don't necessarily know the way that the decision could have been made differently. So it's unfair, you know what I mean? In that advocacy piece, it is unfair to expect that everybody would be able to know any differently. And I think that it honestly, if I don't have all the answers, obviously, but one of the answers is in the retraining, is the retraining of the mindset that providers have. It is in the teaching of advocacy from a patient perspective, and when they don't feel like something is quite right. Clayton gave us great examples of opportunities where it felt like something was wrong. They said something, but were trusting the system that was taking care of them. That is probably all in that moment they could have done, but continue to do it. Continue to do that. Because prayerfully, for the next woman that is having the same scenario or even the same situation, they will question it as well.
Hang tight for me, Dr. Hawkins. I want to bring in Coach Gessie, who's had to advocate for herself. A lot of women here in the audience and on the panel, we've all been through certain things, and we could all do coulda, woulda, shoulda. Yeah, I mean, you can do that for everything. I just don't find it to be helpful for my mental health. But, Coach Gessie, I want to ask you, because I asked during all of these events, what does advocacy look like, even when you think, I'm okay with this, I'm okay with the instructions, I'm okay with the protocols, I'm okay with this? What does advocacy still look like?
First of all, Clayton, I think we all just want to say thank you, and we're praying for you, and we're here to support you. One of the things that I find in the work I do around Black maternal health is that I say, listen to your BAE, okay, your body, your advocates, and your experts. The first thing is, if my body is saying something to me that is not fitting the scenario, right, I have to question it even more. And it starts by something that has been said, understanding that the system is broken. So even in the first conversation with the physician, it's, you know what, given the fact that this is a broken medical system and we know that there's bias in the system, What kind of plan? How are we building into the plan that reality so that we can change the outcomes? And I think that is really important to ground, because I think when we ground the conversation with that awareness, we are saying, wait, we all need to be on high alert, right? We all need to be on high alert. And what does that mean? Because of that, how are we planning for that in order to negotiate challenges in my scenario that may be different than? I remember when I had a brain aneurysm, I had the neurosurgeon say to me, "Oh, you have a significant aneurysm, and I can fit you in my calendar in 8 days, so you can go home and come back." My blood pressure was at 199 top number. Dr. Soyini knows, and every doctor knows, with an aneurysm, that can literally cause it to rupture. And in that moment, Adrianna, because I had been through so much of a need to advocate for myself, I knew I had to push back and say to that doctor, you know what? I will go home when you get my pain under control, because then I know my pressure won't cause this to rupture. But the system that you talk about being broken, Adrianna, you said it over and over. I should be able to just trust the system. That needs to go out the door, because we can't trust the system. Over and over, Dr. Soyini said, is broken. So with that understanding, I need to come to the table and say, okay, how is this now going to inform how we move forward? And that causes me to form a team of advocates, right? And then it causes me to know now, as an expert, the first person I listen to is my gut that says, wait a minute, I got to question it all. It's sad. It's sad. It's very sad that we have to say, no, I can't just take what you said, right? So it doesn't make it easier, but it's the truth.
Mm-hmm. I like what you said about setting the tone from the very first appointment. You know, we know I'm Black, I'm a woman, system doesn't work for me, it's not here for me. So just letting you know, I know this, and I will be calling you. I will be calling the office. I will be scheduling appointments that you say I don't need. I won't be going home when you say I'm going home. I think that setting that tone, and also if you say that to the first OBGYN and they're not receptive, it's an interview.
Fired.
Yeah, fired. You know, I remember with my daughter, I had to go to MFM, again, geriatric pregnancy, et cetera. And there were 2 doctors in this office. And I thought the woman doctor would have been the default one that I trusted. No, it was the man. You know, he was conservative in his medical practice, to the point where I was like, okay, you're a little bit much. I have a built-in advocate in my mom who used to practice medicine. And my mom said, no, that's the guy. That's the guy. And out of his mouth, he said, you're Black, you're a woman, and you're older. And my mom was like he knows. So go with him. And he saved both of my babies. Yeah. So it's just one of those things where I think Black women are always on the defense. I think we are always aware that the systems aren't for us. I think probably where we do ourselves a disservice is underestimating how much fighting we have to do. And that is something that I think, you know, I'm always grateful and indebted to Tanika for these events and spreading this word, because Black women are our biggest advocates. I mean, we're saving everyone and everything, you know. It's like the systems that are best for us are wonderful for everyone else. The systems that aren't for us kill us.
Adrianna, if I can say one more thing, there's an app that I just volunteered to be on their advisory council. It's called the Earth app. It's for birth without bias. They drop off the B. And they're the first of its kind Yelp-like system of ratings and reviews for doctors, GYNs, pediatricians, in terms of caring for Black and brown birthing people. So the other thing is, when we talk about that advocates and engaging our network, is finding out, wait, where is it safe? You remember back in the civil rights era, we needed to know, where is it safe to go get gas? Where is it safe to stay in a hotel? That's the reality that we live in today. Where is it safe for me to deliver? Where is it safe? Because of the care. They're not dismissing my pain. They're listening to me. They are on high alert. They have an awareness of the truth of the situation. So the ratings and reviews and leveraging that information to know, wait a minute, I'm going to learn from the lived experience of people. Because when you go to those Google Doc reviews, they're not talking about culturally sensitive information about how did they deal with medical bias? How do they deal with the maternal mortality issue? They're not rating that, but you have a system that does rate that information. Leverage it, post your reviews so others will learn from it. You know, I'm sorry, I didn't mean to interrupt further, but I just wanted to share that. I know we're short.
No, and I would ask that you would type that, you said it was an app. I would ask that you would type that app into the chat so everyone has access to it. I also want to piggyback a little bit off of what you said, because I know that for a long time, in the Black community, we were saying, see your Black doctors, find your Black OBGYN. And the white man who took care of me was a white guy. But I think, to your point, if you go to a doctor and you can say to them, I'm Black, I'm a woman, I'm older, these are my concerns, are they also your concerns? Then maybe your doctor could look like someone else. I bring it up because I live in the DC metro area. I can find a Black doctor. I can, drop a pin in a bucket, boom, 5, 6, 7 Black doctors. But there are people who live in other parts of the country. It's not a dime a dozen. So I think what you said in the very beginning about asking that question, laying it bare, laying it plain, letting that doctor know, I'm about the business, I'm about my life. And if you're not on board with me, then I will find somebody else. And I think that's a fair comment and question and discussion to have with your medical professionals. Again, it's all an interview, in my opinion.
And it's also asking yourself, because I have to ask myself this thing in so many situations, what role could bias be playing in the recommendation they're making to me now? I hate that we have to say this, but it's true. Again, what role? So I have to think, wait a minute. I've had to say, I think bias may be playing a role here. Can I talk to your supervisor? It is crazy that we have to say these things, but it's the reality. Dr. Soyini, I know you know, it's the reality that we're facing. And the truth is and we're literally fighting for our lives. We're birthing a whole new human being. We're trying to deal with fibroids. We're trying to deal with whatever the health issue is. But we still have to turn around and say, wait a minute, I need to find out where things are.
And I think that's something you don't regret, right?
Yeah.
Like, those are no regrets. The fight is not, you're not going to regret that. Okay, you asked a question, maybe it put the doctor off for a minute, but whatever, I asked. You know what I mean? I'd rather ask you and get it out there than to be worried about it. And should something go wrong, now I'm playing over and over again. Oh, I should have asked this. I should have asked that. I should have done this. And you're not doing yourself any favors. You all know I have an issue staying on time, so I am staying on time tonight. Dr. Hawkins, we do have some questions. If you all in the audience have questions, open up that chat, fire away. I always give a disclaimer that Dr. Hawkins has not looked at your chart. She does not have your medical history, so she can only really answer some general questions, information that you might have. So, don't get too specific, because there's not an answer for that. But we did have a question from Nicole, I believe. Let me scroll up here and find it. She has a procedure this week or next week, I believe. Give me 2 seconds. I'm sorry, there's a lot happening in this chat. She recently had a transvaginal ultrasound and they found a small fibroid. Her doctor said her IUD may be pushing against her uterine wall, causing pelvic pain, and that it could be removed and reinserted. As for the fibroid, the advice is to take ibuprofen for the pain. She's seeing her tomorrow to discuss further. She wants to know, what questions should he ask during her appointment?
I think the first question I would ask is how the fibroid might be impacting the IUD, and if replacing the IUD is going to have the same outcome because the fibroid is still there. That was probably the first striking thing that I thought of, because getting that information, not the holes in it, in the story of what is going on with your body, specifically where that fibroid is, the size of it, and how it's impacting the IUD, is going to help you make a decision about what sounds like your next step might be, is do you replace that IUD or not?
I would also say, and this is something that again, you don't know what you don't know. I had an ultrasound initially with my GYN about fibroids. And my mom, again, my built-in advocate, said, no, you ask for an MRI. Like, you go in there, you ask, you tell them to put whatever code down they need for insurance, because that can be done, and you get your MRI. I went from 3 fibroids on an ultrasound to 6 on the MRI, because they can see better. They can tell you where it is. So I know the question was not directed to me, but I would tell you, Nicole, part of the question tomorrow is, when did you schedule my MRI for? So we can see exactly where this is and what's going on. You know, I also think that if your fibroids are causing a level of pain, the discussion should be about your quality of life. For me and my periods, ibuprofen, Excedrin, all of that, that wasn't really doing anything for me. You know, I could have OD'd on that stuff and it still would have been my uterus hurting. So maybe it's time for a second opinion.
Yeah,
Yeah.
you got it's some holes in there. You need the rest of the story.
Let's see. It looks like Sierra says she's on her 7th surgery. Her last one was April 10th for fibroids, endometriosis, and polyps. Is it time to just get a hysterectomy? I have a son, so I'm not holding onto my uterus for childbearing. I'm just scared. And let me say, I'm just scared. Being scared is a very legitimate feeling. It is a very justifiable feeling. So don't say I'm just scared. You're scared. I'm right there with you. I don't want to diminish, you know, being scared is an actual feeling that you should listen to. As Tori said, it should inform how you're processing and making your decisions.
Yeah, and you're human, so there's nothing wrong with being afraid. I think that fear should be met with, again, information. There's no such thing as information overload when it comes to your body. You really want all of the pieces of the puzzle. You want all of your options in front of you, and you want a great understanding of what is going on with you and how these options can affect what is specifically going on with your situation, especially before you decide to do something. A hysterectomy is a big surgery, potentially, right? Certainly a viable option if you feel like it's the right thing for you based on what your situation is now. So that's a hard one to advise for or against. I'm neither for or against. I think it needs to be particular to your situation. And you want to consider, just as we've spoken about, what is your quality of life?
Okay. Coach Gessie, I would ask you to address the comment she made. I'm just scared. I'm sure you were fearful. How did you approach that?
You know, I think the number one thing is to remember that your fear is an indicator of what's also going on inside of you, right? And sometimes it's an indicator that maybe it's not necessarily the decision that's the problem, but it's the circumstances in terms of the people you're working with. You're not feeling heard enough. You're not feeling that the situation is being addressed in the way, like one of the things, if you're not getting the answers you need, just keep looking for the right person, right? Who's hearing you. Because when you as a patient go in the room, I always say there are 2 experts in the room. There's the physician who is the expert in their field, their specialty. And then there's you, the expert on yourself, right? So number 1 is making sure that your voice is heard. And that means we're starting with being okay with the fact that your fear is an indicator of something for you, and you may not have enough information, as Dr. Hawkins just said. Information in the right context gives you peace, because you now come to a place where you feel you're making the right decision for you.
And a properly informed decision. We have a question from Whitney. She says, when we think about second opinions, would a second opinion from a different doctor, yet in the same network, be sufficient? Or would it be best to get a second opinion from a different network of doctors altogether? That's an interesting question. I hadn't thought of that.
That is an interesting question. I think sometimes second opinions should be an elevation, if at all possible. I believe in subspecialties. I'm a subspecialist, obviously, but I know that there's so much that my PCP can do about my cardiac problems. I might want to see a cardiologist. And in that, I might want to see a cardiologist that takes care of the specific thing that is going on with my heart. and level it up. So if you're going to get a second opinion, when you think about are they in the same network of doctors? There may be someone in that same network of doctors that actually specializes in what's going on with you. That might be the person or the physician or provider that you want to get your second opinion for. I think we don't use our specialists as much as we could. And I had a patient that actually told me today, I wish my doctor was brave enough to have sent me to you sooner. Told me she couldn't do that second and third surgery she did on me.
You know, and I think that is an important caveat to make, because oftentimes we do look at the doctor we go to as the expert, but to your point, Dr. Hawkins, they're the expert in this lane. And so when we talk about fibroids, oftentimes you might have one doctor who specializes in hysterectomy. They can't tell you about any other sort of treatment for fibroids. They're not a radiologist, so they can't, do that. So, you still kind of have to do the research on your own. Google took me down several vortex of insanity, but you have to start somewhere and get a clue somewhere. But I like what you said. I hadn't thought about a second opinion in that regard. Level up your second opinion. Don't just go to a different gyno in a different office. Level up and find out what that specialty is. I think that's really helpful information. V. Ryan says she was recently diagnosed with adenomyosis. I know I didn't pronounce that right. And she found that both her OB and family doctor have either never heard of it or dismissed it as it's nothing serious, or you can schedule a hysterectomy. I hope to have another child, but when the doctors don't even know about this condition, how can I feel secure or trust my doctors with this condition and being pregnant? I'm not a doctor, but I would say you can't trust these doctors.
Okay.
I just don't think, I mean, if you're saying you want to have a child and they're saying hysterectomy, fired. And you lost me at, oh, it's nothing serious. It is to you.
Yeah, and that's completely invalidating. That's not where we should be meeting our women. We just should not be invalidating the things that they're saying is a concern for them, period. Point blank, even if it's a pimple on their forehead.
Right. You know that, and we're almost out of time, but Dr. Hawkins, I do want to discuss with you again, Jessica Pettway's story. This is someone who was misdiagnosed. And I don't even know how you begin to advocate for that, because you got a diagnosis. How do you know you're even misdiagnosed? I mean, how does that even, I don't even know how that would trigger anything.
That story resonates with me so much because it is the story of many women, in that I don't actually call it a misdiagnosis. I call it missed in the diagnosis, because she very well could have had fibroids, right? Fibroids can exist with other things. Fibroids can exist with cervical cancers. Fibroids can exist with PCOS. Fibroids can exist with endometrial cancer, right? We're so commonly told fibroids are benign conditions, and I call them the red herring because it's what we can see on the imaging. And all of these other things are hiding behind either lab tests or further digging or just listening to the patient's story. And so fibroids unfortunately become the star of the show, and everything else takes a back seat. But what we've learned from Jessica's story is a very valuable lesson, in that you can be missed in the diagnosis. I don't think she was misdiagnosed. I think she was missed in her full and whole self. She wasn't treated as a complete woman. She didn't even receive a vaginal exam.
Oh, yeah. We have a question from Rochelle. She says, is there a specific screening or test beyond Pap exams to request for reproductive cancers?
So reproductive cancers is a broad field, because there's so many parts of our reproductive system, from our uterus to our cervix to our ovaries to our fallopian tubes, even, and the different cancers we can get from all of them. And they are all evaluated and tested differently. Specifically for cervical cancer, you can receive a Pap smear, and you can receive a Pap smear with HPV testing. That HPV testing, we feel like in gynecology, is paramount. It's it is not the exception, it should be the rule, along with the cytology. So there was definitely a movement a few years ago within our society to try to separate the two and just do the HPV testing. But many, and many will even on this talk will agree that we don't want less in our diagnostic options for women. We
Right.
want more. We want both. So ask your doctor, are you getting a pap smear less than 30? They don't usually do HPV testing, but again, everybody should be treated individually. Your circumstances, your risk factors should be taken into consideration.
Mhm.
It should not just be based on what the textbook said, right? So that's why
Family history, all of that.
all of it should be a factor in it. And then from there, things like HPV testing is something you want to ask, is that being done? Don't skip that part.
Felicia says she's 34. She'll be 35 in September. She had a transvaginal ultrasound 2 years ago that showed 4 fibroids. She doesn't have children. She does not have a partner. Should she consider freezing her eggs? Also, she's been on birth control pills for more than 10 years. She says her periods have become heavier and heavier, and her gynecologist suggested that she change her birth control and nothing else. And she's asking, I know your eyes are the same. Yeah. Should she consider a myomectomy? Again, not a doctor here, but honey, you got to go to a different person.
Gotta go somewhere else, babe. Every
Yeah.
time there's a change, every time there is a change, you need to shift that lane and we need to reinvestigate. When my patients call and like, oh, Dr. Hawkins, I haven't seen you in a year or two, but this is going on. I'm like, baby, you need to come on in.
Now.
There's no part of this where I'm going to advise you over Instagram or
Right.
Facebook or email.
Right.
Something has changed. You need to come in. Yeah, we're not going to base this year's price is not last year's price, as the saying goes. This year's ultrasound is not last year's ultrasound either.
No, I mean, and that's fair. I went from 0 fibroids to a year later having an enlarged uterus in 3.
Yeah.
A lot can change in a year, you know, especially for issues that we don't know why they even happen, you know? So, let's see here. If it has been confirmed that fibroids are causing swelling in one leg, but they're otherwise asymptomatic, they're mostly pedunculated and subserosal fibroids, no submucosal fibroids, would you recommend removing them prior to pregnancy? She said she had over 30 fibroids removed 9 years ago, same leg swelling that went down after myomectomy. And before you answer that, I tell people, if you are dealing with fibroids, PCOS, endo, adenomyosis, whatever it might be, I went to see a fertility doctor in addition to my gynecologist because they have different priorities and they want to preserve your fertility. And I made sure they talk to each other. And so sometimes that's part of the advocating as well. If this one doesn't hear what your goals are for life, if you're saying I want to have kids and they say, well, maybe a hysterectomy, you got to find somebody else that can come up with a plan that's viable for your dreams. But she's asking, should she go ahead and have these pedunculated fibroids removed before pregnancy?
Yeah. So I think the obvious answer might be probably because you're symptomatic of that fibroid, even though you're not having the typical symptoms that we talk about with fibroids, it's pressing on a vasculature, very likely that's causing this swelling. So can you imagine as the pregnancy and the baby grows, and sometimes the fibroid itself grows from hormonal influence, how that could potentially worsen during pregnancies? But again, I'm not looking at your images. I don't know if that would be the specific right thing for you. I also want to piggyback on what you just said and pull in a point that Clayton made, even if he doesn't know that he made this point. When he wanted to see the maternal fetal medicine specialist, those are specialists that you could even pull into your space before conception. Maternal fetal medicine specialists will even do what we call preconception counseling, depending on what your situation is, what your history is, what has happened before in previous pregnancies, or even things like fibroids. You can request to see a specialist beyond even that reproductive fertility specialist that may be able to say, I've had patients go see maternal fetal medicine specialists to give me advice on adhesions and how that might grow with the pregnancy. and what the outcomes could be, and give advice about what we might want to do with that now in preparation for. So there's a couple different ways to get that question answered, but that understanding and the full picture, the education and the knowledge of that is going to help you decide what's best for you.
You know, and you bring up something too, that when we're building our team, and Coach Gessie talked about the teams, the advocates and the experts, maybe the person on your team is someone who is very willing to collaborate with their colleagues in, oh, you know this is your expertise. Okay, I'm leaning on you for this. We're all working together to figure out what's best. So maybe one of the questions as you're advocating is, who's on your team? Not just what other gynecologists are available if you're out of town and I have a baby. Who is on your team? What's their name? And this is where we go down the Google black hole. We're finding out everything about the team. Kimberly Dawkins wants to know, how long does it take for the body to heal after an open myomectomy? She has a 6-week follow-up appointment after surgery. What tests and assessments could I have to assess healing? I guess I'm wondering what is happening in my body now after having so many fibroids taken out.
Yeah, you got to kind of trust the process of that healing. I always tell my patients, God needs 12 weeks to work, give or take, right? It's not a perfect number, but about 3 months is what we tell patients, is that process to where you might get to your 99%, where you might get to your new normal, I call it. Anything short of that, yes, we release you to the world and we release restrictions, and you can start to, dance and jump and exercise and have sex around, on average, 6 to 8 weeks for most providers. It depends on your surgery, obviously, but that's because it's hard to hurt anything at that point, not because you're done with your healing process. You have to continue to listen to your body. There's no test that you need, my dear. You need to follow up with your exams, your post-op appointments. You need to continue to listen to your body and be honest with your doctor about what your concerns might be, even if it's just, I'm urinating more frequently than I did at my first 2 weeks of surgery. That could be pointing to something that needs to be evaluated. But you have to have grace with yourself during this process of healing. It takes a little while.
And I also wouldn't compare myself to anybody else's experience. You know, someone might heal in 2 weeks, someone might heal in 8, but a myomectomy, an open myomectomy, is a huge surgery. This is not, like a broken arm. This is a big deal. It's essentially a C-section. I mean, when I had my kids via C-section, they came out of that same myomectomy scar. So it's a huge deal. So I would just, to Dr. Hawkins' point, listen to yourself. This is when you're listening to your body. And should you feel like there's any issues arising, yeah, we're on the phone with the doctor and the team.
Can I interject something there, Adrianna?
Yeah.
One thing to just note, because I've had this happen so many times, is as you're healing, pay attention to your poop. It sounds funny, but if your bowels are slowing, or if they're slow and they're not moving, it can be an indicator of an obstruction developing. So just pay attention to it. If you feel that, wait a minute, I was going to the bathroom more frequently. I had an occurrence where after my second myomectomy, 10 days later, I developed a small bowel obstruction, which is basically your small intestine is knotted. I was going to the bathroom fine, a couple of days in, day 7, day 8. I was like, wait a minute, I'm going to the bathroom. It feels like it's a little bit harder to go. Like it's slower. It feels like I'm not passing gas more regularly. It feels like it's a little bit more laborious. Well, day 10, it turns out now I'm starting to vomit. And I know that that's a sign all physicians will tell you. If you're starting to vomit, make sure to call your doctor right away. And it turns out I had a small bowel obstruction. So walking, is something obviously really good in the healing process to help your body. But key is just paying attention to that.
So I apologize. I'm not going to get to every question in the chat. I will say thank you so much to everyone who is here tonight for being so engaging and involved and feeling comfortable to ask your questions. I want to bring Clayton back and all of our panelists. Tori had to leave us for the night, but I want to ask each of you if there's just a summary you have, a moral of the story, words of encouragement for those of us who are listening tonight, what would that be? And Dr. Hawkins, I'll start with you.
So I would say that a recurring theme for tonight that we've all piggybacked on several times is that notion of advocacy. The reason I bring that up, not because it's an obvious one, is because that's not always a comfortable space for everybody. I consider myself non-confrontational, so I kind of go with the flow. I might actually go back and let her do my hair a second time, even though she jacked it up the first, because that's just how I am. And naturally, that's how some people are. So for people like myself, bringing my husband, because that man is a bulldog when it comes to things about me, he's going to ask a question that I'm actually embarrassed to ask, or I feel like, babe, like calm down, simmer down. But he's doing the right thing, right? For me. So sometimes if you can't feel comfortable in that space of advocacy, phone a friend. Bring your mother, bring your grandma, bring that auntie that sometimes speaks too much to be there with you. Bring a doula, bring a supportive system or a supportive mate. And there's so many resources in our communities that can help us do that, to help us advocate for ourselves. Continue to practice it on your own, but sometimes it does take phone a friend to get a true advocacy for yourself and your healthcare. And that's okay too.
And Dr. Hawkins, before I let you go for the night, there was one other question that I certainly did want to ask you, again, about Jessica Pettway. And I think you briefly touched on it, but you said that this was a missed diagnosis, not a misdiagnosis. If anyone is feeling that gut intuition, what are the questions? What does that feeling, that intuition feel like? How do we mitigate and advocate in that situation?
The thing about cervical cancer in this country is that it really is almost 100% a preventable disease. Pap smears are what we do as a screening test, right? So screening means that we're trying to catch it before it becomes a problem. And HPV is the hallmark of what, the HPV high risk types that we see account for 70% of those that turn to cervical cancer. And it usually takes about 10 years from a positive pap smear, positive HPV test, before we see early stage cervical cancer. That journey, of course, is not the same for everyone, but for the most part, it's a preventable disease. So the questions that I would ask again to your provider is, what should my cadence be? Because you telling me to come back here in 3 or 5 years is not comfortable for me, right? Should I come back every year? And I tell my patients, I don't do PAPs very often anymore, but I tell my patients, if that's what's comfortable for you, sweetheart, that's what we're going to do. Your insurance will pay for you to get a pap smear every year. There's nothing wrong with that. Even though we have clinical recommendations based on research, we have to understand that gut feeling of the patient, and we have to understand that every patient's scenario, situation, and risk factors are different. But cervical cancer in this country should be 100% preventable. Get your HPV vaccine, vaccinate your children, and if you're uncomfortable with that, ask questions that might get some answers as to directing you on how to do that. But there's so much here in the US of A that can be done to help prevent what happened with Jessica. She was missed in the diagnosis, and it's really deplorable.
I will say I go to the gynecologist once a year and have a pap smear, just because why not? Insurance pays for it. And that's how my fibroids are found. So, I mean, it doesn't hurt. That's the thing. It's not, it doesn't hurt. So you might as well do it. Clayton, how would you, or would you offer any words of encouragement? Anything that you think our audience should know and take away and remember as they're going down this pregnancy journey or health journey, or really going to see a doctor about anything?
Yeah, I think just fitting in here tonight, I think they're already attending this. They're doing the right thing. And this was very informative for me. I wrote down some of my own notes, and I will piggyback on what Dr. Soyini said around the advocacy. You have to. It's an unfortunate part of the system, but the system does rely on us patients having to be our best advocates. And if that means that, you don't feel comfortable doing it yourself, you mentioned that you had your mom that came with you. I wish, we would have brought one of Krystal's friends that was a little more familiar with medical terminology, a lot of this. So find that person, whoever they may be, and help let them be your helper, your advocate, because the way that the current system is you really got to fight for yourself the most.
Thank you so much again, Clayton, for sharing your story, for being here tonight. We all mean what we say when we're here to support you. So anything you need, if there's any foundation, any nonprofit, anything that we can do to support Krystal and her legacy, then certainly be sure to let us know. And let me go ahead and bring in Tanika to wrap things up. As usual, thank you all so much for inviting me to host. It's always a pleasure to be a part of these sessions and spread the awareness. Tanika, you always say the silence will be what kills us. So the more we talk, the more we share, the more we're open and vulnerable and courageous in telling our stories, the more we're helping the next person. And until we see some major changes in the medical field, this is the best we can do.
Absolutely. Thank you so much, Adrianna. I just want everyone to send Clayton love in the chat. I know we have supported him throughout tonight, but I just want just a barrage of hearts and whatever we can send to show him our support and our gratitude for being here tonight and just being vulnerable and honest and really using his wife's story and her voice to really advocate for her and also give us tips on what we can do to not only support ourselves, but support our sisters. Everybody, tonight was great, very emotional. I cried many times, but I know that Tori would say that getting it out and releasing it is a good thing. So never shy away from your tears and what you're feeling and the emotional things that you're going through. We are planning our I don't know what year this is, 10th, our 10th year anniversary. And I got confused because I know we haven't had empowerment experience for 10 years. But anyway, we started this organization in 2014, and I'm so proud of all the work that we've been able to do, all the conversations we've had. And this is our 10th year, and Empowerment Experience this year is going to be incredible. It's going to be July 11th through the 13th in Washington, D.C. at the Conrad Hotel. And we'd love for all of you to join us. This is going to be 3 days of empowerment, of inspiration, of resources. If you've ever come to Empowerment Experience, just drop it in the chat. It is a wonderful, wonderful time. It's not your average conference. It's one of